One drug maker is slashing the price of its weight loss drug in order to make it more accessible. Eli Lilly says it's now selling one-dose vials of Zepbound, which is a 4-week supply for roughly half the usual monthly list price. The lowest dose will go for about $400 a month. The next dose is $550 a month.
This is a new move by pharmaceutical companies to sell prescription medication directly to consumers. Now, you still do need a prescription from a clinician, doctor, or other kind of clinician, for an FDA-approved indication in order to fill a prescription. But it is a new move to directly market, to directly sell to consumers.
Dr. Gounder says the lower cost drugs should be available to consumers immediately at the company's Lilly Direct website with a valid prescription, as she said. Explaining the possible harms of COVID-19 is the most effective strategy to convince people to get vaccinated. A study published in the Journal of Public Health gave 3 groups different messages: the harms, the benefits for yourself, and the benefits for others. 72% of people who heard about the potential harms got vaccinated, up to 10% higher than the other 2 groups. All 3 groups had a higher vaccination rates than a 4th group given no message. Adding greenery to a neighborhood can lower the inflammation rates of residents. A study by the University of Louisville planted more than 8,000 large trees and shrubs in a 4-mile square area and compared the neighborhood's health to the surrounding community. Residents had up to 20% lower levels of a biomarker of general inflammation. And there's a racial divide in the amount of testing patients receive when they come to emergency departments with common symptoms like nausea or chest pain. A study published in JAMA Network Open found Black patients are 26% less likely to receive a diagnostic test, and white patients may be subject to over-testing. Researchers say this puts Black patients at an increased risk for missed diagnoses.